Jonathan, I'm going to give it one more minute and then we'll get started. Just because there's so many people coming in. All right. We are going to get started, and I just want to welcome all the participation in our first Justice Involved Reentry Initiatives Advisory Committee meeting. And this meeting is being recorded. Next slide. Just a little overview of the agenda, and I know that our advisory committee members should have received this as well. And these slides will be on our website after the presentation for everybody. So welcome. We're going to do welcome and introductions, and then go over the context settings on the Nevada Reentry Initiatives, orientation to the Nevada Reentry Initiatives Advisory Committee, and then a closer look at Nevada's Reentry Initiative. We have about 15 minutes for Q&A, and then next steps, our meetings that we have some dates picked out and times, and we can have a little poll or discussion around that as well. So very excited. We've got 69 people in this meeting already. So let's start with our introductions. Okay, again, thank you so much for all the participation. And this is a big project, but a really important one. And we've just had a great response from so many different people in the community, sister agencies, nonprofits, people with lived experience, and we're excited to get this going. All right, so I just wanted to introduce our team here that we have today from Division of Healthcare Financing and Policy. And this team is facilitating the Reentry Advisory Committee, as well as we've been working on this project for about over the last year and a half. And we're going to show you where we are today and where we hope to be going, especially with all of your input. So our team, our chief is Michael Gordon, and he is the chief of community and provider engagement, as well as this federal waiver unit. Melinda Southard is our deputy administrator over many programs, and this is one of them. Myself, I'm Deidre Manley, and I am a manager chief over the waiver unit. Richard McFeely, who is our management analyst, and Jonathan Figueroa, who is also manning the slideshow today. He is a social services program specialist. Vanessa Ramey, who is an IT professional, as well as the project coordinator on this project. Casey Angris, who is our division compliance chief. And Minden Hall, who is a social services program specialist supervisor.
Your call has been forwarded.
Amber Neff, who is a management
At the tone,
analyst.
Please record your message. When you have finished recording, you may hang up.
Thank you. Okay. And Bernadette DeMars, who is a social service program specialist. And the other three people that you see here is, this is our vendor, our contractor that is an expert in this field and working with other states as well, is Manat. And I'm going to hand it off to Manat. And I believe, I think it was
Hi,
Allison.
Deidre. It is. Hi there,
Yay.
everyone. Thank you so much for kicking us off, Deidre. Hi, my name is Allison Garsamunde. As Deidre mentioned, I'm part of the Manat team that has been supporting Nevada over the course of almost a year already in kicking things off for their reentry initiatives. Very excited to be here today. I'm joined by my colleague, Kinda Sarafi. She's a partner with Manat who is overseeing our engagement and who is a subject matter expert in the area of reentry. She's been working with a number of states and pursuing these initiatives, as well as by my colleague joined today, Sarah White, who is a consultant with Manat, and she has been providing support since the beginning of this engagement again. So we are so excited to be finally kicking off our advisory committee and really looking forward to working with all of you in the months to come to get this thing up and running. And Deidre, I think it's on me. We're going to move to the next slide and give a view of everybody that has joined. Oh, we're actually going to take a moment just to cover some housekeeping items before we get into the substance. So as Deidre was mentioning, this advisory committee is really about the opportunity for cross collaboration and really want to ensure that this is a forum where all of you can bring your questions and your comments on the reentry initiative. So to that end, want to make sure you know the various mechanisms for your participation throughout this meeting and the meetings to come. We're having folks that are joining both by computer and phone. We're muting everyone upon entry just to close off some of that background noise. But again, we very much want to hear from you. So as you can see, for folks who are participating via Teams, the meeting chat is open. Please feel free at any time to drop questions or comments into the chat. We'll be trying to respond to them in real time during our discussion today, particularly during that time that we have saved for Q&A towards the close of the presentation. But we will also be recording them to be able to loop back where needed and make sure that we're tracking all of your very valuable feedback. So please avail yourself of that chat box. As it notes on the slide, and I see Judy starting to go there. Thank you so much, Judy. If you wouldn't mind, just in the interest of time and in lieu of a verbal roll call today, we're going to ask folks just to drop your name and your organization into the chat for us so that everybody can have a look at who it is that's joining us today. And again, so that we can make sure that we have a line of sight on our partners so that we're bringing you all along for today's discussion as well as moving forward. Once we get to our Q&A section, and we'll remind you of this when we get there, we'll give folks the opportunity to come off mute, whether raising your hand to chime in with a comment or just coming off mute and being able to chime in during that Q&A process. If you're listening by phone, the way that you do that is by pressing *6 to unmute your line or *5 to raise your hand. So we'll remind you of that as we get closer to our discussion period. But again, just want to emphasize that we're really looking forward to hearing from all of you. And last but not least, as Deidre noted, the meeting will be recorded and transcribed, just so you're aware of that. And if you would like a copy of the webinar transcript coming out of today's conversation, please reach out to the email address you see here on the slide, 1115waivers@dhcfp.nv.gov, and we can drop that email into the chat in just a bit once our names are through so that folks have that and can copy that. So on the next slide, just to give an overview as folks are dropping their names and organizations into the chat of who the advisory committee members are. As you're all well aware, everyone that is listed on these slides submitted an application to be part of the advisory committee, and we're so excited with the response that we've gotten. As you'll see, we have a very diverse group representing all of the various implementation partners that have a role to play in successful implementation. That includes state and county agencies, correctional partners, both at the state and the county level, and also at the juvenile facilities as well. We're joined by individuals who actually have lived experience, whether with reentry into the community or perhaps have family members who have been incarcerated, so represented here today. And on our next slide, You'll see we're also joined by providers, by advocacy groups, a number of community partners, and by managed care organizations. So just a glance of the very diverse group that's going to be both participating in the advisory committee and, again, integral to the success of this initiative. So thanks again for joining us. I will move us along to the next slide, and thanks to everyone who's dropping their information into the chat. For those of you just joining, we're looking for names and organizations. So next slide, please. So just to level set and provide you all with a little context on why it is that we're here today, and moreover, why it is that Nevada is pursuing their reentry initiative. As I'm sure many folks on the phone are aware, individuals who are justice involved, or those who have spent time in jails or in a prison, oftentimes have very particular healthcare needs, unique healthcare needs to their experience. That's true both in Nevada, where you can see on the slide just a glance at some information with regards to the various needs of individuals who are transitioning from incarceration. That includes mental health needs, in some instances, substance use disorder needs, which is prevalent in Nevada, but as you'll also see, is prevalent nationally as well. And so what this reentry initiative is really all about is addressing the healthcare needs for justice-involved populations, and is what is a driving impetus for the work that we're all here to do together. On the next slide. So recognizing the unique healthcare needs of the justice-involved population, Nevada recognizes that one of the tools that can be brought to bear on addressing those healthcare needs is Medicaid enrollment, right? Medicaid provides access to healthcare services, including treatment for mental and behavioral health issues for incarcerated individuals that are returning to their community. Of note, prior to this initiative, and as has been longstanding the case in federal law, states have historically been unable to use Medicaid funding to provide healthcare services to individuals while they are incarcerated. And that's due to a provision of federal law that's known as the inmate exclusion. Notably for our purposes, in 2023, so a couple years back, the federal government, the Center for Medicare and Medicaid Services, issued guidance to states describing to them an opportunity to be able to request a Section 1115 waiver from the federal government, which would allow states to provide a targeted set of Medicaid services to individuals who are getting ready to transition from a carceral environment back to their communities, with the set of services for youth and adults to support their successful reentry into the community. So the federal government made that opportunity available for states to elect to pursue. Also in 2023, Congress passed a new federal law called the Consolidated Appropriations Act, as you'll see here on that last bullet of the slide. And that law actually requires all states, so not just Nevada, all states, for their Medicaid agencies to provide a targeted set of services to eligible juveniles. So there was both the opportunity and the option for states to pursue, and then this requirement for all states to provide services to eligible juveniles. In addition, right around the same time when that was moving forward at the federal level, Nevada's legislature also passed Assembly Bill 389. And so that's a state law which required DHCFP, that's Nevada's state Medicaid agency, to seek one of these Section 1115 reentry demonstration waivers to provide this set of services to youth and adults. So for the 90 days prior to scheduled release before they're transitioning to the community. So in alignment with that legislature, last year, DHCFP got to work in developing and submitting this waiver, requesting the authority from the federal government to provide this targeted set of pre-release services to youth and adults. through the Medicaid demonstration program. And that was submitted in December of 2024. And the state is moving forward with CMS while that waiver to be approved by the federal government. DHCFP has also been actively working with partners throughout the state to implement those federal mandatory requirements for providing services to juveniles as required under the Consolidated Appropriations Act, or CAA. So lots of information, but really the takeaway there is that this is a relatively new, an exciting opportunity that DHCFP is pursuing in line with this new opportunity from the federal government to develop and to soon launch these initiatives to provide these reentry services to individuals reentering their communities. Next slide, and I think I hand it back to Minden, perhaps.
You do, thank you. So with the policies that Allison mentioned, supporting youth and adults transitioning from correctional facilities into the community is very important. During this transition time, individuals are at a higher risk of experiencing emergency department visits, hospitalizations, and even deaths from overdose. This initiative allows Nevada to use Medicaid funding to provide a target set of services in the 90 days prior to their expected release date. The support can improve health outcomes and successful reentry into the community. Next slide, please. Nevada submitted the Medicaid Section 1115 reentry demonstration waiver in December of 2024, and we're waiting for approval from the Center of Medicare and Medicaid Services, also known as CMS. This map shows all the states in dark blue that are approved for the reentry initiative, and those in gray, like Nevada, shows that the states have submitted the application and are pending approval. We've had a few meetings with the Center for Medicare and Medicaid Services and are in negotiations currently. This is new to everyone from judicial to Medicaid. And in the meantime, we are watching and learning from other states on how they're implementing the initiative. Each day prevents challenges and changes, and we have to be flexible. When I hear flexible, it reminds me of the episode in Friends where they're moving a couch up the winding staircase and Ross keeps yelling, "Pivot, pivot, pivot." Bear with us. This is where we're all learning the changes and we are pivoting. This advisory committee is so important in assisting with these changes, and it will be a place to discuss challenges and successes to share and learn from. So next slide, please. So there's a lot on this slide. It does explain how the initiatives are broken down. And currently we're working on the first initiative, which is for incarcerated youth, which all the states were eligible for January and started January 1st of 2025. Medicaid is partially ready, and we have done a lot of work while meeting with correctional facilities. Deidre will go more into this in depth later on in the presentation. You'll also see on this slide later this year in the fall or winter, after the 1115 waiver is approved, we will expand services to adults. Similar to the CAA, which is the youth, and Medicaid eligible incarcerated adults and youth will, with specific health conditions, will be provided care management and medication-assisted treatment, also known as MAT, 90 days pre-release, as well as a 30-day supply of medications at the time of release. So next slide, please. This slide explains how the initiative is broken down, and currently we're working with the Incarcerated Youth Initiative, which, sorry, this one is our goals. I'd like to point out a few of the goals that this committee's discussions will help Medicaid accomplish. The third one down, improving coordination and communication. And then the fifth one down, improving connections between carceral settings and community services. The discussions that will happen during these meetings will open doors of communication between correctional facilities and community services and be a great way for us to network. Next slide, please. This slide gives you an idea of Medicaid's implementation process and the milestone dates. I'd like to reiterate that DHCFP is moving forward with continued policy and operational planning in selected facilities following the waiver approval. We are in the first quarter, and we have accomplished the last bullet, convening this Reentry Advisory Committee. Yay! Notice in the second quarter, the future quarter times and dates are dependent on Center of Medicaid and Medicare and Medicaid Services waiver approval. After the waiver is approved, quarters 3 and 4 will take place. So the next slide, please, and then I'm going to pass it along to Deidre.
Thank you, Minden. And just remember pivot. That's important here. So I'm just going to give a little overview of the Nevada Reentry Initiative's Advisory Committee and why we need you here and what we're all going to do, because you play a really important, critical role in this process. Next slide, please. All right, so really, you're going to play a critical role in the successful implementation of the Nevada Reentry Initiatives, and so many of you already have. It's really exciting to see so many names and faces on here that I've known some for a long time and some that I've just gotten to know. Michael Gordon and I, our chief, and Bill Teal, who is a retired captain, have been going around Nevada and meeting different jails and juvenile justice departments and just, getting tours and really learning about what all the challenges are that is faced out there in the communities, especially the rural and frontier communities. So the purpose is for this advisory committee is to advise and support, again, in the successful launch and implementation. And that includes the Section 1115 demonstration, and that's what we keep referring to as the waiver, and the CAA, we refer to it as that often, is the Consolidated Appropriations Act. Membership. So again, we have people with lived experience, state agencies, county agencies, prisons, county jails, sheriff's association, juvenile justice facilities, probation, parole, community partners, nonprofits, managed care plans, and providers. And so we have a wealth of resources here on this call, which is really exciting. The advisory committee will be meeting virtually for 90 minutes. So they will be 90 minutes in the future. They will meet bi-monthly, and we will give you more details on that towards the end of the slideshow, as well as following up with reminders. Next slide, please. So the meetings enable direct communication and problem solving between Division of Healthcare Financing and Policy and key initiative implementers. And we're asking as members to bring a collaborative, pragmatic, and solution-oriented mindset. Our objectives are the advisory committee will offer regular input on key policy and implementation issues related to the pre-planning readiness and operationalization of Nevada's reentry initiatives. There's some big words in there. Review and provide feedback on select policy and operational decisions. Expectations of advisory committee members, and we've really selected and invited people to be part of this for their expertise. And we expect that if you can consistently attend and actively participate in these meetings, if you could delegate someone to attend in for you and bring questions to those meetings or possible solutions or ideas. If you could review agendas in advance of each meeting and then provide input when requested, that way we're able to get through everything in 90 minutes. This is a lot of work. Keep statements respectful, constructive, and relevant to the agenda and agenda topic and as brief as possible. And being solution oriented, offering alternative or suggested revisions when possible, and representing whatever population that you're here to represent or advocate for. You can also always email us if you want to set up a phone call with us. We will provide all the information for that on this call, and we are happy to do that. We are here to partner with all of you. That's what we have to do in order to make this work. So we're available. And we enjoy talking to you. We learn a lot from all of you. On meeting preparation, we will be circulating agendas and pre-decisional materials for review in advance of meetings. You will be receiving those. And we will be conducting outreach to the advisory committee before and after meetings to solicit additional input. Next slide, please. All right. So as part of the advisory committee application and some were invitations, applicants were asked to provide feedback on areas of interest to inform DHCFP's future meeting planning. And I can also tell you that as we have been going out to jails and juvenile detention facilities and having some really good meetings with sister agencies, we're really seeing the same, some of these questions or ideas about discussions in our talks with other agencies as well as the response we got from everyone. So really what we have flagged is ensuring continuity of care and program design. So including to facilitate a cross-system communication. That's where people say it's so challenging, and we know it is, where there's so many of us on here that all work in different areas, that we all speak a different language sometimes. We don't understand how one system works. And so we're really trying, we're not going to solve it all, but we're trying to understand all that, where everyone's coming from. And so that was a big one there. And then also getting individuals Medicaid prior to their release. And so again, we're seeing the challenges, but we're also seeing maybe what some of the jails have figured out and what they are doing that's maybe working. So collecting all that information, we want to share that in these meetings. Addressing potential barriers and access to service, especially again for the small and rural facilities. Those short-term jail stays that can be really hard to get people on Medicaid, assess what their needs are, and get them some resources. So that's another topic. And then additional topics central to successful implementation would be eligibility criteria, IT infrastructure updates, provider qualification and enrollment requirements, and then ensuring that the program reduces recidivism, increases rehabilitation, and encourages successful reentry to the community. Next slide, please. Okay, we're going to take a little deeper dive into some of those slides that Minden was sharing before, and there are some really good examples too in the slide deck in the appendix as well that I just want to, you know, we'll put them in the chat so that you can look at them and track them. That might help as I'm explaining this. This is very complicated, and if you've asked questions before and they're still confusing, please do not hesitate to ask again. Even us as a team, sometimes we have to ask the question to each other out loud several times to be able to understand it, and it's complicated. So the slides that I kind of want to point out that can be very helpful that Minden provided earlier was slide 9 and slide 12, and they might help a little bit here as I'm talking. And then there is a crosswalk in the appendix on slide 32. All right, so next slide, please. Okay, so starting in 2025, Nevada, we had applied prior to 2025, we applied for a waiver. And when we say waiver, that is a Medicaid waiver that waives some of the rules. And so in states that apply for waivers, when they apply for them, they spend a lot of time designing them specific to their state and what challenges they're facing and that sort of thing. So our state applied for a waiver that will provide extra support to youth and adults for 90 days prior to release. That has not been approved yet. It has been submitted, and we are talking to Medicaid every week. So we are having those conversations. We are meeting with them virtually, and we're in the process of that. And you can see in that map that Minden showed the states that have been approved, and we're in negotiations at this time. So in 2025, the mandated CAA, also referred to as the Consolidated Appropriation Act, mandatory across all states. For Medicaid enrolled children and youth, 30 days pre-released who are under the age of 21 years, or former foster youth that are between the ages of 18 and 26. And when we refer to former foster youth in this population, they have had to have aged out of foster care or the system of that system. And that they are being held in a correctional facility post-adjudication. And you can, if you go down to the end of the slide, you can see what that definition is. So that's where we are right now. When the waiver goes through, upon the launch of the demonstration waiver, Medicaid eligible, and they have to be eligible, adults and youth, children, pre and post, so they will be pre-adjudication and post-adjudication, can obtain services 90 days pre-released. Adults, the qualification would be adults who have a mental illness, a substance use disorder, chronic disease or other significant disease, an intellectual or developmental disability, a traumatic brain injury, HIV, or who are pregnant or up to 12 weeks postpartum. And so again, when we have been out touring the facilities and meeting with the staff, in these facilities, we've heard across the board how much things have changed in the jails, and even in the juvenile detention centers, the mental illness and the substance use disorder that is really their biggest population, and really challenging now in their settings, because they weren't really equipped for all that, and having the staff and the resources. So as this waiver goes through, we will now be able to offer that financial reimbursement for Medicaid eligible adults and youth who might need these services. Youth Medicaid CHIP eligible youth under 21 aged out of foster care, so up to the age of 26. So if they're 24 and they're in their screening, they said they aged out of foster care, they were in foster care, and maybe were in a group home, left the system at 18, they would qualify for as a youth still. So, and they do not, that population now, and when the waiver goes through, they do not have to have a behavioral health or chronic condition criteria to receive services. Next slide, please. All right, so again, eligible correctional facilities currently are state-operated juvenile justice facilities and county-operated juvenile detention centers or youth camps that host post-adjudicated eligible youth, so post-adjudicated. And in the future, our state prisons, our county and city-operated jails that opt in, and any remaining facilities. So again, that's opting in. We are not mandating this. This is a benefit to the facilities for budgetary purposes, the communities that people are reentering, and saving lives and rehabilitation. So that's what that looks like. So currently, and then in the future. And again, all participating facilities that house post-adjudicated CAA, Consolidated Appropriation Act eligible youth will be required to provide eligible youth in their facilities with the required services of case management, screening, and diagnostic services that are also covered under the demonstration. Next slide, please. So what do we know? What have we been learning? Right now, we know the landscape in Nevada. We have 7 prisons across the state, and there's over 10,500 individuals daily, including 209 when this was done of individuals 20 or younger in prisons. The county jails, there's 26 county and city operated jails across the state, 17 counties, including 5 temporary holding facilities. And you can see that Clark and Washoe are the 2 largest facilities. And then we have our juvenile facilities. So the Division of Child and Family Services oversees 3 state-operated juvenile justice facilities. And then there are 7 county-operated juvenile detention centers and 2 youth camps. Next slide, please. Again, what is covered? What is covered in the Medicaid Reentry Initiative? So facilities that participate in the Medicaid Reentry Initiative, so if you choose to participate, will be required to provide access to the services described below upon launch. Services can be provided by either correctional facilities and or community-based reached-in providers. And we have, yesterday we were in Lyon County, and we're able to see how Department of Health and Human Services with Lyon County has some workers housed inside the jail that are doing this case management and FAST and most. So there's different ways that people are doing this, and there's some communities that do not have those resources. So that's what we're here to work on and problem solve if this is something that you choose to participate in. So the reentry care management is physical and behavioral health needs, as well as health-related social needs, and to make appropriate linkage and referrals to post-release care and supports. And then we have our medication for opioid use disorder and medication for alcohol use disorder. So approved medication and combined with counseling and behavioral therapies. Medication upon hand and release. So this is not a script upon release. This is medication in hand for at least 30 days, a supply of prescription medications at the point of release as clinically appropriate. And then hoping to prevent emergency department visits, hospitalization, death, or, coming back to jail. We've heard from some of the jails that people come back sometimes just to be able to get their medication. CAA screening and diagnostic services for youth, including comprehensive health, developmental history, and physical examinations. And we will work with facilities participating in the Medicaid Reentry Initiative to provide technical assistance and build capacity to provide these services. Facilities will be required to demonstrate readiness before they can receive Medicaid reimbursement for services. And we have some agencies that are, reach out to us quite a bit and are in communication, and really excited about this. Next slide, please. In addition, these are in addition to the mandatory benefits for the reentry initiative. We do recognize there's other related services that can help, and so these are additional services that can also be offered and reimbursed for if they qualify for Medicaid. The physical and behavioral health clinical consultation services for adults, lab and radiology services consistent with what Medicaid would typically cover, prescribed drugs and medication administration during the pre-release period, and consistent with whatever Medicaid would typically cover for those services. So 90 days prior to the release date, you can be reimbursed for that. HIV services, which we've heard from the jails how expensive that is, and they're, some of them they're coming out of their budget for the last year for somebody who's an inmate. And services of a community health worker, post-release education and training related to patient self-management of health conditions, and peer support services post-release. So those are all additional benefits. The clinical consultation is mandatory for the CAA eligible youth. Next slide, please. So challenges that we are seeing, again, we got this information came also from your responses of committee members, as well as when we're out there in the communities in these jails. So I'm going to go through this pretty quickly so we can get to Q&A. Where we're seeing challenges and implementation, again, is enrollment in Medicaid. Medicaid experience, correctional facilities, this is all new. They don't necessarily have the staff. And if they do, their staff probably don't know how to bill Medicaid. Medicaid billing and claiming. So having an IT system to bill and claim for the provisions of Medicaid services is another project. Pre and post release case management, providing medication while some facilities do provide some medication-assisted treatment for opioid use disorder, there's still that varies, and that can be really challenging, and cross-system collaboration. And then finally, is our capacity funds to support implementing partners. So Nevada has requested 19.5 million in total funds to provide startup funding to correctional facilities and implementation for partners for the planning process. And what that can provide. Next slide, please. Sorry. Okay. So we have applied for this. These funds are they're for one-time funds available to correctional facilities and implementing partners. And it's intended to support planning and implementation activities. Funds are not intended to be used to sustain the delivery of the reentry services. So when you are able to start billing Medicaid, we're going to help you get there. When you're able to start billing Medicaid and getting that money back that is coming out of your budget, you should be able to sustain this implementation, and that's the hope. And there's a list of permissible uses of funding as well. So I am going to hand this off to Minden, and we are going to take questions and go from there. Thank you.
Thank you, Deidre. Let's go to the next slide. I know it just says Q&A, but now you know. So this is the time that we'll go ahead and ask questions. Before I have Bernadette read off the questions in the chat, just if we can't answer any of those questions today, we will make sure that we get back to you. And also you can raise your hand and we'll go that way. So I'm first going to start with the chat real quick. So Bernadette, if you could read those for us, if there's any.
Sure. The first question I see is from Tom. I have found that one of the major barriers to successful reentry is the lack of supportive housing following the individual's release from incarceration. Does this initiative provide any support in this area?
Deidre or Allison, would you like to answer that?
I'm happy to chime in if that's helpful. Thanks so much, Tom, for the comments. So one of the key services, as Deidre was talking about as it relates to this initiative, is for the provision of case management to individuals who are going to be transitioning to the community. Case managers will be required as part of federal requirements, and those are subject to DHCFPs, the division's ongoing design, to develop a comprehensive care plan for individuals, right? So the idea is that the case manager will meet with that individual, will assess their needs, and that's meant to include both their physical and behavioral health needs, as well as potentially their health-related social needs, such as supportive housing or other supports in the community. And so as part of that case management activity, case managers will be developing this reentry care plan that will need to take into account the sort of full suite of services to include things like supportive housing. So that is contemplated in terms of the initiative and in providing supports to make those connections. Adrian, Minden, or others on the line, if you want to chime in.
The only thing I could say is that case management that Allison mentioned is, it's comprehensive case management, like you said, and person-centered, and it's not just currently a lot of the facilities, are the staffing level they have, they're not able to get reimbursed for those services. they're literally just handing someone, you know, a list of resources and hoping that they go out the door and follow up on that. So that case management will be more intensive.
A good important point, DJ.
Okay, we have a question from Maggie. The medications for discharge or release, will any other prescribed medications be covered outside of MAT prescriptions?
I'm happy to take this one as well. So yes, the requirements around medications upon release include those medications that are clinically appropriate. So if that individual does require MAT, it would include MAT, but it's also meant to encompass other medications that are clinically appropriate for that individual in alignment with the state's existing coverage under its Medicaid state plan. So it is broader than just MAT. And it's in line with existing medication coverage as dictated by the state plan.
Wonderful. Thank you for addressing that. The question was basically, I had asked because currently for our MAP program, we are providing the 30-day prescriptions for Suboxone or naltrexone and other co-occurring medications such as mental health medications or whatever that they're prescribed. Our contract, though, for our contracted medical provider only stipulates 7 days. We do the 30 days out of courtesy, but this is obviously a game changer for all of those across the board. So I just wanted to double check with you to make sure.
That's really helpful. That's great to hear.
Thank you.
Absolutely. Thank you.
Our next question from David. Every program in Washoe County which currently bills Medicaid for substance use disorder, bright line denies persons convicted of certain crimes. Will this program allow programs that use screening other than case by case be allowed to participate? That is, will programs be allowed to cherry pick their clients on something other than a case by case basis?
So I can take this one again. The intent of the waiver initiative is that it would be available to all individuals. The related services would be available to all individuals who qualify as eligible for the reentry services, right? So this waiver allows for a waiver of existing federal law so that individuals who have not been able to receive these services would be allowed to receive these services upon implementation of the demonstration. So this would not be, there would not be an ability to deny medications in the context of the reentry demonstration if they're clinically appropriate for that person. And all individuals that meet eligibility requirements for the reentry initiative will receive will have the opportunity for those case management services, for that health needs assessment, to get the full spectrum of what their needs are. And again, to facilitate access to those services in the 90 days prior to release, and then to connect them through their case manager to services in the post-release period. So again, the intent of the demonstration is not to be able to cherry pick on a case-by-case basis, but to make these services to all who qualify under the initiative as clinically appropriate.
And Allie, let me expand on that. And this is Michael Gordon. I'm the chief over the Federal Waiver Unit. I think reading that question a couple of times, I think the concern there on that question is whether we can force a provider to provide those services. And that the answer is no. So Medicaid does not have the ability to force a provider to take certain clients or not certain clients. We don't have that control over our Medicaid contracts. And so that might be an additional concern for that specific provider that you might want to go back to that provider with and see what they're willing to do.
Thanks, Michael. That's a very helpful clarification.
Our next question from Brandon, who is currently providing the case management?
And I will be happy to take this one too. Brandon, I know you were on earlier during our public hearing and you had some questions on case management. This is part of that. This group coming together as an advisory committee is helping guide some of what's going to be able to be provided through that case management. So we're still in implementation planning stage for the waiver, so we don't exactly have a full answer to that. A list was actually emailed to you about who our current providers are under the TCM, but we're happy to have more conversation as we move forward as far as how is case management concerned.
Okay, great. Thank you. Yeah, I think there's a lot of questions that other people have as well about the service provision surrounding case management and how that's going to look. So I hope we can all put our heads together and come up with some best practices on how that will look. Thank you.
Our next question from Magdalena. I believe this is from the previous question. In addition to that response, for how long will the case managers work with the individual?
So when the waiver goes through, they can 30 days prior to release, and then after would be 30 days or for youth and for adults. They do when they are released from jail or prison, they would be reapplying for their Medicaid to see what they qualify for, but there will be a warm handoff and working with the case manager if they're embedded in the carceral facility, and then an outside case manager. But some systems may choose to have outside case managers work with their incarcerated individuals inside the facility, and then that would be the same agency that would work with them outside. So it's going to be very individualized what the facilities decide to do. Did that answer the question, Magdalena? And it's good to see you here. Okay, next question.
Okay, next question in the chat, and then I also see hands up too. We'll take that after a couple more chats. This is from Kevin. I attended today's public comment session on TCM services and wanted to follow up with a question. Have qualified providers aligning with TCM staffing requirements already been identified, and are they currently delivering TCM services to both youth and adults? Additionally, if providers are in place, could you share any insights on their capacity, service areas, and any challenges they may be facing in implementation?
This is Michael, and I will take that. The answer is no. So that SPA was going to public hearing today, just to get the ball rolling. This is that SPA that was placed for targeted case management is a brand new SPA that was provided through the CAA initiations. And so it is very new. It's a new target group. And so we're still trying to ensure that we get the right providers in that group. But no one has been, we haven't had any initiations into eligibility for that target management group. And but we are open to suggestions as we move on.
Thank you.
Question from Diana. For those of us who have an existing reentry program, which includes case management, can we apply for funding to strengthen and expand our services?
I couldn't hear all of that question.
For those of us who have an existing reentry program, which includes case management, can we apply for funding to strengthen and expand our services?
This is Michael. I'll take that. I'm not sure at this point what our capacity billing funds will allow in that retrospect. That is a question we can take back and see if there's any room in that avenue of funding.
I
Sounds like
see.
Okay, sorry.
I was gonna allow Lance to ask his question, please.
Yeah, I started in the chat. I was talking about juvenile detention centers are typically designed for the temporary housing of youth that are pre-adjudicated. Is there any, this could be a large part of that population. Is there any talks of expansion for the pre-adjudicated youth? And then typically an adjudicated youth in a temporary holding center, which is a detention center, are going to a correctional center, right? Or releasing back into the community at times. Any talks of that and how we, when we talk about an adjudicated youth, is it each adjudication or is it just once adjudicated, they always qualify?
Allie, do you mind taking that one?
I'm happy to. So under the demonstration, right, we have our Consolidated Appropriations Act requirements that have gone live now as of January 1st, and the state is working very hard to implement those. Those are the ones that apply to post-adjudication youth. When the reentry demonstration waiver is approved, hopefully soon, a little later this year by CMS, that will expand eligibility to include both pre and post-adjudicated youth. And so we hear you. We know particularly in juvenile detention centers, there can be a very quick turn. Juveniles can be, either being placed at a youth correctional facility within the state or being sent, back re-entering their community, potentially via probation. So there is a lot of design work to do to try to figure out across all these populations, how do we catch that individual? How do we get them enrolled in Medicaid if they are not yet enrolled in Medicaid coverage? And how many services can we provide in the amount of time that they are in that facility or transitioning again to the community? So just to say they will be eligible, because I know we're at time, they will be eligible once the demonstration is approved by CMS. Pre and post adjudicated youth will be eligible for services, and lots of design work and conversations to be had to figure out exactly how that works across these various settings, knowing that there's a lot of different considerations around timing and how many services we'd be able to provide and connecting them to services in the community. So hopefully that's helpful, and more to come on that.
So we have another question. I think we still have some hands up, and we can stay on here, and we can also get back to any of you in an email or phone call if you have to jump off. So do we want to go to the next question? Was there another question in the chat, Bernadette, that we hadn't addressed?
Yes. From Judy, will SAPDA certification be required for an agency to bill Medicaid for peer support and CHW services?
I think that's one that we'll have to take back, Deidre or Michael, unless you guys have any answers off the top.
Yes.
We'll take that one back. Yep. And my guess is that it's subject to continued design work. We haven't gotten into that level of detail. So it's helpful just to be tracking it as an issue and a question.
Yes.
Another question or comment from Brandon. I had some concerns I sent to DHCFP about the requirements of case management providers, and worry that we may not have enough providers that meet the 5-year minimum experience they have suggested, especially for a newer program, and that case management is often done as inclusive service by current programs versus a separately billable service. I think I'm seeing a common concern around the services provision of case management. I'd like to see us do a deeper dive surrounding the service.
And as
Yes.
already pointed out, we've noted that, Brendan, and we are going to take that back. Okay.
That was from earlier. Sorry.
Next question from Sandra. Do we know if the reimbursement for reentry services be comparable to 100% of Medicare or Medicaid rates currently on fee sheets? Knowing this in advance will allow businesses to hire as needed help to ensure these services are sustainable.
Michael, welcome you. Yep. I see you.
Yeah, Michael.
So the services that are authorized under the waiver will be set at regular Medicaid rates. There's not a separate fee schedule for the waiver.
Was there any other ones we didn't get, Bernadette?
I think it was just mine, right? Hi, this is Regina from Anthem Blue Cross Blue Shield. My
Okay.
question was about pharmacies. The plan to use the on-site pharmacy within the carceral settings to issue the medications, pre-release, day of release, because it gets kind of muddy if you wait till the day after, right? Because then we have to make sure that all the insurance companies are contracted with the pharmacy. So just wanted to know if you have any idea, and if not, we may be a little premature here.
I'll let Michael answer that because we're,
Okay.
you know, again, we're seeing a lot of different things out there.
Yeah, I was gonna have to pass that one on to Ally. I think we're too early in the stage to fully contemplate this one, but
Yeah,
Ally.
this is definitely subject to continued design work. We understand the complexities around medications and hand upon release. We know that some carceral facilities have their own on-site pharmacies. Others partner with community-based pharmacies. As you mentioned, there's a lot of complexity with making sure that that handoff happens as seamlessly as possible to the managed care organization. So we recognize this as a place where we'll have to do a lot of thinking. As Minden will show you in a slide to follow for all of you that are hanging on, we do have a planned meeting coming down the road that will focus on medication administration and medications in hand. So subject to continued design work, recognize that this is a really thorny issue and would really encourage you to join all of our meetings, but particularly that one if it's something that you're already thinking about, because we know that hearing from folks about how it's currently working and what some of the implementation challenges are likely to be will be really critical to making sure that we're designing it appropriately and for successful implementation. So thanks for raising it. It's an important issue.
Thank you.
Great. So I think that's all the time that we have since we are running over. Any questions that we were not able to respond to, we will email you. And then also, if you want to go to the next slide, please, Jonathan. In here, you will see our email address, the 1115waivers@dhcfp.nv.gov. You can always email us there with any questions and we can get back to you with a response. Also, I wanted to know, it's hard to see, and I'm sorry about that. At the bottom, we do have a listserv. We recommend that you sign up so that you can get information on these meetings and for any information we have coming out. Let's go to the next slide, please. Oh, next one. Great. So this is, Allison had mentioned, these are our upcoming meeting dates. You'll see it's every other month right now for this year. And then hopefully next year we can make them quarterly. With this said, we wanted to mention the following meetings. We are looking at a 90-minute meeting so that it'll be longer and we can ask more questions and share more information. And also we're looking at starting the meetings at 4 p.m., hoping that that would be easier for people to attend those meetings. Let's go to the next slide. Perfect. I know it's blank, but we wanted to make sure that you read through these appendices and that it has great information. And this is what our slide deck was kind of built off of. So, you know, if you read those and have questions, please email out to us. And Deidre, did you have anything else?
Thank you all so much for your participation and asking great questions. And I can't wait to see you guys next time and questions that you have and learning from each other. So, but please reach out. We will get right back to you. That's what we're here for. And I will see you guys soon.
Thanks so much, everyone.
Thank you.
Thank you.
Great day.
Thanks,
Thanks
guys.
everybody.
All right, thank you.
Thank you.
Great work, guys.
But yeah, that's.
I would have. Better have her put it in a thing for me. Then I'll drink it. I almost took this from you. Yeah. I'm gonna walk back. It's so